my last question to you is, there's a lot of myth that is regarding IVF, and I'm just reading it off over here. And it says, is genetic testing done before IUI and IVF? And in case of myth, I remember someone had written, there's a lot of myths regarding IVF. It's a lazy way out. Mothers are usually shamed, and why is that? Is it true that IVF babies are more prone to fetal abnormalities and regular pregnancy than regular pregnancy? Does it lead to preterm birth? Is normal delivery never an option for an IUI or an IVF mother? Okay, and I heard babies born through IVF are never healthy. Now these are things I've heard throughout. Could you just bust these myths?
I'll tell you. See, if you're looking at genetic testing for all, see, IUI there is no genetic testing because you're just putting the sperm inside, there is nothing testing.
Yeah.
Now in IVF, in patients with some kind of genetic abnormalities or repeated failures, we have the provision to do a biopsy of the embryo and know if there is a genetic abnormality in the embryo before we put it inside. So that option is there, but not necessarily every patient has to go through that. There is an additional treatment that is required in certain group of patients who has a problem, not in all patients. One. So that genetic testing part is gone. Now to do with definitely yes, to a certain extent people are shamed. Now that is something that we cannot do anything about. Now about people going for an IVF are definitely at some point of time have to go through this because this question of whether they are doing what kind of treatment and things like that. So I cannot. That is something that is happening on the back end. And what else was there in the myth?
About the child not being healthy.
See, now because what you should always understand is that now every pregnancy has around 1 to 2% chance of having an abnormal child. Every pregnancy, whether it is an IVF or something. Probably if you look at IVF, it can be say around 1 to 1.5. Like what is 1 would probably be 1.5% like that. So now probably whether we don't know whether it is because of the procedure per se, whether it is because of the procedure that we are doing, or because already these gametes are not able to fuse and become pregnant and we are forcefully doing it. So whether it is something to do with the gametes or whether it is something to do with the process, we really don't know. But then that is a very minuscule. A lot of people deny it. A lot of people, earlier studies and all said that there is no role for any effect of any this thing. But then there are certain studies which did tell us that yes, there is a small role for, there is a small rise in patients, babies with some kind of abnormalities in the child. But then the percentage is extremely low. We are talking about 1 to 1.5%. So what you should understand is 98.5% of the times the babies are normal. Okay, so and that 1% is that issue is always there even if you are having a normal pregnancy. It's nothing to do with IVF.
So there is a risk even with a normal pregnancy.
Yes, there is a 1% to 2% chance of having an abnormal child even in a normal pregnancy, and that probably is a slightly increase. I wouldn't deny the fact because there are conflicting data, conflicting evidence which say that yes, certain studies that say that it's slightly increased. Some studies say there is no. But let's go with the worser.
Sorry, are you talking also about Down syndrome children with the IVF thing? Because that's what I've also heard.
No, Down syndrome has nothing to do with that. See, Down syndrome is probably majority of the time is not because of IVF or anything. Down syndrome is basically because older age women, when we are doing IVF, the older age women have a higher tendency. That is even naturally or with an IVF.
Okay.
With an IVF will not increase the chances of a Down syndrome. It is only an older woman will probably have a higher risk of having a baby with Down syndrome. So that is why we always in the 3rd month of the pregnancy test. That is one of the commonest tests that we do during the 3rd month to make sure that the baby does not have any kind of aneuploidies or kind of diseases like Down syndrome.
So what is the long term, you said that there is a chance of the health deteriorating, right? That's what you said?
Not really. There are some kind of syndromes that they say. These are like I said, there are very, very rare entities which, to be very honest, I have not come across here because they say that there is a very high, low possibility. Now we have seen abnormalities but then that is not to do with, like I said, that 1% chance, no, that 1% abnormal, any baby will have some kind of an abnormality. I have only seen that group of people. I have not seen a disease that is probably because of an IVF or something like that. Honestly, I have not seen it yet. I have not seen it, at least in our place.
Long term
probably I have not seen, because we have seen our children, like I said, we started IVF when it was in 1996, so probably we have 98 is probably our first baby that was born. So we've had children for the last like 25, 26 years, 25 years old. So till now we've not seen any major abnormalities in the
Ooh,
babies.
that's good to know. Anyway, so that ends our Q&A. Guys, I hope you enjoyed watching this video. I know it has been a long, long one. Thank you so much, Dr.
Thank you so much.
Gopinath, for joining me for this session. I am so glad that I could do this. Bye for now. Is there anything you would like to
That's
say?
fine. Thank you so much for this opportunity, and I think probably this is basically one of the reasons that I agreed to this this discussion is because there are a lot of these myths, there's a lot of these facts which people should know.
Yes.
People are not aware of, or people have this misconception about this treatment. So I felt that this is probably the right opportunity, the right platform. Her YouTube channel probably the right platform with so much of an audience that the information goes into the right group of audience. Probably yes, you're looking at women who are mostly on the reproductive age category. Most of your followers.
Kids, I hope you're listening to this.
So probably it's very important, and that is the group of people who should know all these things,
Yes,
and it's
absolutely.
very important for
That
them to
knowledge
understand.
is power, actually. So I hope you find this helpful then. Yeah?
Sure,
Take care,
thank you.
guys. I'll see you later. Bye for now.